right. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on our agenda for today, Heather?
Today we have, and I'm going to just say it like this, Dr. Kumar, the Chief Medical Officer of World Class Health. He is a longtime practicing cardiologist and
Geriatrician.
geriatrician. Thank you. And he's now leading World Class Health as their Chief Medical Officer, which is essentially, really quick summary, is it's essentially institutes of health that are in other countries, right? So like going to find the best providers, the best facilities, the best hospitals for the right things.
On a global scale.
On a global scale. It's available through employer benefits only at this time, but really interesting stuff that they're doing.
Actually like sending you to the best place to get the treatment you need.
Exactly. Yeah. So, because sometimes it's less expensive to go to another country to get something done than it is to get it done here in the US. So,
yep.
So there you have it.
There you go. So, without further ado, let's get into our conversation with Dr. Kumar from World Class Health.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Dr. Kumar Dharmarajan, Chief Medical Officer of World Class Health. Welcome to the show, Dr. Kumar.
It's a pleasure to be here. Thanks for having me.
Great. So glad to have you. This is going to be a really interesting conversation. We haven't really tackled this topic yet on the show, yet it's like one of these things, access, transparency, all these things are kind of like this. I like to refer to it as kind of a red thread that comes up a lot in our show because of all the innovation that's happening. And those are the things that we're trying to really address, right? Like those are the things that people care about. So I'm really excited for this conversation. So really glad that you're here with us today.
Yeah, I love to talk about all those things. I think super important for patients, for business, and pretty much anyone who engages with the healthcare system.
Yeah, which is just about anybody, right?
As it
Well,
is.
At one point or another,
yeah, for good or for worse, right? Whether you want to, you don't. It's going to happen. Well, tell us your story. How did you become a part of World Class Health? Give us a little bit of your background and your clinical journey and all of that. So,
Yeah, would love to. So as you could tell, I'm a physician, and I actually come from a family of physicians. My parents, mother-in-law, et cetera. My wife's a physician, but I wanted to really take my own spin, my own path within healthcare. And so for me, it was really focusing on healthcare quality as my personal calling. And it started, I was a researcher at Yale focusing on healthcare quality. I was lucky enough to be part of the group that built most of the quality measures Medicare uses. That's the program for older adults in the US. All their hospital measures, if you ever hear about readmissions or star ratings or group bill
star,
platform.
yep.
Yeah, because that's consumer friendly, right? How many stars as opposed to something more complicated. I built software to improve quality for doctors. And then that focus on quality, you talked about like a red thread that gets pulled through. That's sort of my red thread. But then it became, hey, let's do something really audacious, which is not just advanced quality, very important, obviously, but let's also do our best to make care affordable, all the same while maintaining and elevating quality, and make it be a great experience for patients. Because let's be real, the experience many patients have with the healthcare system could be improved in many different ways, and let's do that on a global scale. And we really got a great group of leaders from tech and the benefit space and insurance and consumer products and myself. And we set off on this mission, and it's been a great mission and great experience so far.
Awesome. Yeah.
Okay, this is wide scope stuff.
Oh, yeah.
Okay, we haven't done one of these in a while.
I know. That's what I was saying. This one's going to be a little bit different.
All right, I never know what we're talking about till we get there.
Yeah, we like to keep Jeremy in surprise, so they asks all the best questions. So,
Bring it
yep.
on.
Yeah,
Yeah.
perfect. And so you're a cardiologist and geriatrician. Am I saying that correctly?
Yeah. So cardiologist, so a heart doctor, as well
Uh-huh.
as a geriatrician, means a doctor who's it got extra training to care for healthcare issues that the elderly have. And actually, I didn't fall very far from the tree. My mom's a cardiologist, and my dad is a geriatrician, and I became a geriatric cardiologist. But
Just
I
put
took
them
a different
together.
path, really in quality in the private sector, where my parents are more traditional clinicians and academics.
Got it. Got it. So you've worked in clinical practice though prior to this, and then now you're kind of in this, well, kind of a startup space, really, is what it is. With all the innovation and bringing this kind of this new concept here. So what actually got you involved? Like what kind I mean, obviously you got the family, kind of the family roots, obviously kind of born into this, but like what was it really that inspired you to look at things from a global perspective and really look at cost and all those things?
Yeah, I mean, so first off, the problems of cost and quality and access, they're not just US challenges, they're truly global challenges. And they're something that, companies around the world, people around the world are dealing with. So that was one opportunity. We were looking at what was happening in the US around improving cost, quality, access, and there were usually US-based solutions. So we wanted to do something that, yes, could provide care in the US, super important, patients locally in their communities, that elevates all of those areas that we're trying to go after, but also gives them global network access, whether that's someplace near shore to them, near shore to the US, somewhere in North America, or around the world where they may be actually more comfortable getting care because a lot of people in the US come from abroad, whether they're in the technology industry or financial services, agribusiness, whatever. Uh, some people are just more comfortable receiving care back home. And so when you think about sort of break free of that constraint of care just needs to be local, to say, yeah, care can be local. Lots of people want that. Most people want that. But if you think about care opportunities from a global perspective, you can really provide access to the top 1% doctors and hospitals around the world. You can greatly lower costs. I can give you some examples, like a heart surgery. I live in New York City and I'm a cardiologist. A heart surgery, bypass surgery, to get a blocked blood vessel open, that can be like $200,000, $250,000 in New York City.
Wow.
Top hospital in India that's better than 99% of US hospitals, it's less than $10,000. And if you
That's
just
crazy.
pick places around the world, it's just incredibly different. And most people just don't know that because the prices we pay in the US are very, very high.
Wow.
This is why so many Arizonans go to Mexico.
Hmm.
Yeah.
Yeah, there's a lot of that cross-border promotion down here in like the southern part. When you drive in, like when you're getting near Mexico, you'll see these big billboards. A lot of dental work happens
Oh, the
down.
dentists in
Not saying
particular.
it's always the greatest, but there is a lot that happens down there.
If you find the right one, there's great
There
dentists.
are some really
There,
good
there's a
ones.
town just over the border that's just full of dentists
Yeah,
working on Americans. It's
right.
the whole town.
That is kind of
Yeah.
crazy though.
What I would say with that is, so a lot of folks who don't have insurance or don't want to wait for a procedure in the US do pursue it sometimes overseas. Dentistry is a great example of that because it can be so much cheaper. The
Mhm.
experience can actually be much better. The timeline to getting care can be quicker. I really group that as sort of medical tourism in a way. When we
Yeah.
think about, and you've probably heard that term, when we think about
Oh, yeah.
global network access, we don't really love that term medical tourism because sometimes it's not fully vetted quality. It's not necessarily a provider that's doing long-term management to make sure your outcomes are good beyond that. And so for us, whenever we think about global network access, it's with the same bar that it should be for local. And so that's top 1% doctor, top 1% hospital, follow-up throughout, nurse navigation throughout. And so there's a big opportunity even to elevate that experience for people who travel for care.
And are there things that you're doing or you can potentially do to balance those costs across, the entire global market like that? Like, why can't ours cost $10,000 instead of $200,000 when it costs $10,000 other places? And I know it's America, and that's pretty much all you need to know, maybe. But is there a way to bring the industry together and kind of regulate these things across the board?
Well, I think this is an interesting data point that maybe not all of your viewers would know, right? So if there's a given hospital, let's say you're in Phoenix, right? So let's say there's a hospital in Phoenix and they're going to do a hip replacement procedure, right? That's a pretty standard joint replacement procedure. And let's say the price for someone like you and me would be $50,000. I'm just saying give or take, and that's pretty accurate, right? That's the total price in a hospital. the price that same hospital and the same doctor charges for the same procedure, if it's Medicare, it's probably around 15 to $20,000. So literally same doctor, same hospital, same procedure, and probably in a more complicated patient because they're older, they're Medicare, they're usually 65 and older. So they need sometimes more support services than, let's say, a younger patient undergoing a procedure. Huge differences. And that's because in the US, the government does a big job of controlling rates in Medicare and some other parts of the healthcare market. But all those extra costs end up going to the quote unquote commercial insurance side. So that's when a company provides health insurance for its employees, which is 160 million Americans. So it's a big group of people. It's actually bigger than Medicare. It can be two times, three times, four times more expensive. And so our solution is really getting in that space because we already know how inflated it is. And I can spend all day talking about why that may be. Middlemen, non-transparent prices. No one knows what's being charged. No one knows what's being paid. No one knows who's taking the markup. Well, there might be people who know, but usually the person paying for it, which is the company, and the employee, because it's part of your co-pays and your deductibles and your co-insurance and all that, they're the ones suffering. And that's why there's so much opportunity because we already know Medicare is paying like a third of the cost for the same procedure in the US.
Wow. Yeah, you guys
Yeah.
got a lot of work to do.
Yeah, that's a big deal. So and so we've kind of set up the problem here, there's glo we live in a global economy. Like doesn't matter how which way you cut it, right? Healthcare doesn't stop there. So I think there's a couple things. You've got one, we know that there's really good doctors in other countries that people don't know about, right? I think that's important, the cost transparency piece. But how does world-class health show up specifically? I know that you're working with employers, I think only, and then obviously you've got the network. So can you maybe just explain a little bit how world-class health is a part of this and kind of solving those problems?
I would love to. So it's true. We work with large employers, and those employers who technically quote unquote self-insure. So that means they pool their healthcare risk across their population, and they work with what's called a third-party administrator, TPA, like a United or an Aetna or a Blue Cross Blue Shield to administer that benefit. So they're self-insured company. And what we do is we bring our global network to that company, and it really becomes additive to the network offered by that, United or Blue Cross insurer, which tends to be local where the patient are. So imagine this is the local network and the global network comes around it. So suddenly you're an employee and you have access to local care as well as global care through us. We then have a team of nurses that navigates patients. So if you call us saying, hey, I'm interested in a knee replacement, or I'm thinking about bariatric surgery or a GYN surgery, whatever, if it's a planned elective procedure, we'll talk to you about our network. And if you're interested, we'll literally help you get all your medical records, have it evaluated. A doctor will speak to you, and it's a highly vetted doctor. So we use third-party data to get doctors with the lowest complication rates who practice medicine the right way, which is something as a patient, you never know. Like, how does my doctor
Mm.
practice? What are my doctor's outcomes? Can I trust what my doctor is saying? So we go after a very small subset of doctors based on data that are much, much better than average. And then we pre-negotiate rates with them. So we know for this procedure, it's $18,000. For this, it's 26. So that's the doctor in the hospital. So when you combine global network, our nurses that navigate, prices that are clear up front, then we can bring that to an employer and say, hey, we're going to improve outcomes, we're going to improve experience for your employees, and we're going to save you money because what we're paying, let's say $24,000 for, your health plan pays 44,000 for 50. And that data is now publicly available in the last few years, which is a key part of this whole idea of transparency. So when you have data that's available, we know how our prices compare, we know our quality, and employers are really jumping at this because it's cost savings for them, better experience, and better outcomes.
Yeah.
That's a lot, but that's what we're doing.
Yeah, the cost transparency alone, right? Like the fact this is not a new thing that I'm about to say, but like the fact that we don't know how much something costs, that is usually pretty big, right? It's going to be a big number. Um, that's scary, right? I
It
think,
feels like when you walk into a restaurant and you open the menu and there's no prices on it, and you're like,
yeah,
"Oh no, this is going to be expensive."
that's a
It's that same
okay.
feeling, no matter no matter what you're doing, when they're like, "Oh, we don't really know how much it's going to cost. We'll tell you later." It's
Yeah.
like, "Oh
The
no."
lobster is market price, right?
Yeah,
But
it's
there's no dollar amount on there.
your
Yeah.
heart surgery is market price today, and you're like, "Oh no."
So you're telling them, okay, first of all, like just this whole experience that you just described, like having a conversation with a nurse and like a doctor before I even have like before I even decide what I'm doing. Like I'm not just being like forced into this, right? Like cuz usually it's like, well, who's available, right? I guess I'll just go to that one to have those that I don't know, just the idea of choice and then to know what it's going to cost.
It's
Like
also frustrating, isn't it? It's
it,
hard to even talk about
right,
it.
like is this real?
Yeah, it feels, I mean, we're very conditioned to, oh, which doctor is in network? Who's going to see me? Oh, I have to figure out how to get an appointment. It takes
Yes.
to get an appointment. Do I get hit with the bill? What is it going to cost? Am I going to figure that out after or before? I need to talk to my health plan about it. Oh, by the way, now it's time for a procedure. I'm going to be hit with like a $3,000 copay or something even before the procedure happens. We've all gotten, if we've had health insurance, those sort of EOBs or explanation of benefits from the insurance company after, or these bills, and it says, my doctor charged 20,000 for something. I, the insurance company, paid $3,226. You may owe something, right? And
Hmm.
that's really challenging, right? And it's stress inducing. And
Hmm.
most Americans don't have a ton of disposable income available. And again, to your point, you said it. These are large purchases. These are not like $10 treatments. They're much, much more expensive. And it's sort of the anti-Amazon experience or anti-Walmart or anti-online shopping. It is exactly what you said. I'm going to use that analogy. It is going to the restaurant and just saying market price, right? And you
Oh,
don't know what it's going to cost ahead of time. And I don't know of any purchasing decisions we make in our day-to-day lives where we have no transparency into cost or that quality. It is, yet it's something I think you said really early on, it's deeply affecting healthcare impacts all of
hmm.
us, our family members. And at the time we need healthcare, we're often, if we're feeling sick or in pain or have anxiousness about it, it's usually not a situation where like there's nothing else in our minds and this and that. So it's a stressful situation with no transparency. And we not only provide that transparency, but we have a nurse that really is along the whole way before the procedure, during, after, and sometimes we'll follow patients for up to a year
Oh
after the
wow.
procedure to make sure things are going well. So you have your own nurse throughout the whole experience. And the nurse has that empathy because I, nurses, I've never met a nurse who doesn't have empathy for patients. That's why most nurses go into nursing.
Hmm.
Uh, they're, and they can really relate. And so I think, we all could do better if we had a nurse in our corner when we were getting medical care.
Oh, absolutely. Yeah, nurses are like, yeah, they're like they understand the human condition, right? Like they've got hearts of gold and whereas doctors, we need them because they understand like the inner workings of like all the things. Like we need you to be on top of that.
Well, there's a reason we have both. They're very different
Right. We
roles,
need you
and
both.
yeah,
So that's really nice. And I mean, even just to think about that sounds like just calming, right? Like because big surgeries
it's like having a doula,
is
a personal nurse like that gets you through the pre,
yeah,
everything leading up to it, through the thing itself,
a
make sure
surgery
you're good
doula. Yeah.
afterwards. Yeah, it's really kind of like a doula sort of thing.
We joke that everyone needs a doula for everything. There should be a doula for everything.
I
Surgery
agree. And
doulas.
surgery doula, I mean, that is a good way to think about it. And not only do they help you get through the whole process as you were saying it, they actually work with your doctor. I mean, how many times as a
Mm.
patient do you, oh, I filled this form out for the 10th time in a row. Why don't my doctors talk to each other? How could they not know that? Et cetera, et cetera. And there's lots of reasons for that too. But having this coach whose job it is to sort of bring people together in the interests of the patient. And so an example might be before surgery, say someone's having an obesity surgery, bariatric surgery. We'll also understand the diet that the patient is supposed to be on, our nurse will, and they'll work with the patient to help them change that diet that needs to change in the few weeks before surgery. Or let's say they had an orthopedic procedure and they need to do physical therapy and rehab to get back to function. We'll work with them to set those up, to make sure they're attending them, to, work that out. And so it not only supports the patient, but it actually results in better health because we can help them be more adherent, do the self-care that's needed, educate them when they have questions. So it's like the experience part is key, but also the clinical outcome improvement part is also key. And that's how we can get
And
better doctors too, because they
Mhm.
like interacting with nurses rather than administrators. And so to the extent that our teams can coordinate, they can have that clinician to clinician sort of interaction, which is different than other sorts of interactions.
and is this the world being what it is? I have to ask, is this in-person stuff with the nurse? Like, is the nurse there with you, or is this an online thing, or is it some of each, or
Yeah, so our nurses are remote, so phone call, video, other forms of communication. The doctor care is obviously in person to have procedures like surgery. And so, but we will work with doctors and other clinicians in your community to try and bridge sort of the local as well as the telehealth version of it to deliver the really great outcomes.
there you go.
So obviously, world-class health, we're talking, I think, primarily about, well, I guess coming from our perspective, being an American, right? Like doctors and facilities outside of the United States. But I'm thinking like if you're working with a very global company, could there be somebody in a different country, not the US, that might want to come here? So it can go both ways, correct?
Yeah, so great question. So World Class Health has both a domestic network of thousands of providers in the US already, right? So we are all across the country, as well as a global network. So why is that important to have both domestic as well as global? Because to us, global means truly global, not just international from the US's perspective. It means
Hmm.
everywhere. And I should have been clearer on that from the beginning. You want to have domestic, high value, high quality providers because most patients are not going to travel. Most patients are going to get care locally for all sorts of reasons why we can imagine, right? But for the subset who want access to the global network, we also have that in place. So we're basically giving both choices. And then to your point, with that global network, again, US and international, there's also the opportunity for someone to come into the US for care. Now, care in the US can sometimes be more expensive than other parts of the world, but sometimes you might need to go get cancer care at a very top center because you have a rare cancer in the US, or you have a very complex heart condition and you need to go to amazing quaternary center in the United States that can do the exact type of heart surgery you need. And so, yeah, we think about it as US staying in the US, US going abroad, international staying in that country, and international coming into the US. But when you have global network, all of that becomes possible.
Hmm, that's really cool. I've been thinking about a couple of different scenarios where, like my aunt, for example, she's originally from Germany and she had recurring cancer. She actually went home for her back to Germany, actually for cancer treatment, and stayed there for several months, going through chemo and all that kind of stuff. And then she came back here to Arizona. And then even thinking like another kind of inside of the US, a friend of mine, again, it wasn't through, she had her own insurance, so it wasn't through an employer, but I think it's kind of a similar example where it was actually cheaper for her to get, I think it was an ACL surgery on her knee here in Arizona than it was in Washington State. So she actually paid, and owns a condo here too. But for her, it was just the bottom line cost was that it cost her less to come here to fly, get the surgery in Arizona, and then go home. So do you see those kinds of scenarios, or I guess both technically?
Absolutely, absolutely. So with your latter scenario, just let me give you an example. So just again, I'm doing heart surgery because the numbers are bigger, so it's easier to
Hmm.
see these differences. But I was just in California last week, and one of the cities I was in was San Francisco, and just within the San Francisco metro, forget the rest of California, the price variation for cardiac bypass surgery was less than $100,000 to more than $500,000. And there's no relationship
Wow.
between the cost paid and the quality of that institution. So we're not talking about, hey, the differences between like 240,000 and 255,000 across like 70 hospitals. It is between less than 100,000 and more than 500,000 for the same surgery.
How,
So that's within one city, right? For one procedure, right? And that's shocking, right?
Right. It's
And there's
crazy.
how does
no
that happen?
transparency in that. So can one understand why care might cost more than it needs to when consumers and employers through their health plans have zero visibility into that? And so what again, our model is, can we find the provider that's less than average cost, but much better than average quality? And they exist within pretty
Mhm.
much all markets. And so when you see that just within one city, then I totally can understand why going from, let's say, Seattle to Arizona could result in savings. There may have even been savings within the Washington area had that data been available, right?
Mm.
For your friend to be able to
Right.
select,
And
basically to shop based on that, right?
Yeah.
not only are the prices that different, but you don't know which one you're in until after it's done.
Right.
Right.
Like,
Exactly.
wow.
So
And
crazy.
how do they justify that? Like, is there any way to even nearly logically explain why those differences occur like that? Like, what are
Well, I
they
would
doing to
Yeah.
their price sheets to justify that?
Yeah.
Yeah. So the way prices work in the US healthcare system, this is sort of a general concept, is every hospital has what's called a charge master, where they say this is the list price of the procedures, right? But the issue is those list prices are usually nonsensical. And so maybe a $50,000 procedure may have a list price of 500,000 or 400,000. And then the insurance company is trying to get a discount off the list price. And so they go to the employer and say, let's say that procedure that was $200,000 on the charge master, and the insurance company only paid 50,000 for it. That was the negotiated rate. Well, they said, wow, I got you a 75% discount from 200,000 to 50,000. Look, employer, I'm doing really great on your behalf as this third party administrator for your self-insured health plan. But the issue is that $200,000 list price is a nonsensical number. You know, we've probably been in stores before where it's like 90% off, everything on sale, and you're looking at something like a shirt, and it's still like $100 or $50, or and you're like, that's 90% off. Let's say it was $100, but I never would have paid like $1,000 for a shirt. So it's a nonsensical list price number at the top. That is how our healthcare system works. Most people don't know that. Who benefits when list prices are really marked up, negotiated and not public? Negotiated prices are marked down, but they're also not public, right? They're part of the secret contracts
Mhm.
between
Like the
payers,
insurance and yeah.
right, insurance company and providers. Well, and then there's a spread between 200,000 and 50. And usually they'll say, okay, I knocked it down 150K. I'm going to get a percentage of those savings. So that 150,000, what if I get 20%? I'll take an extra 30,000 on that. But it's on a made up number, right? And that is how our healthcare system works. And so you can understand there why there's so much waste and abuse, and
Mhm.
structurally some of the participants benefits from the lack of light shining there, right? Like where there's not openness and transparency, there are people getting their cut basically. And so our ethos is to be transparent on the prices that we're paying, transparent on the benchmarks, meaning what the prevailing rate is against which we compare our prices. um, and that's just key to our reason for being. And we think when that happens, when you're transparent on price, transparent on quality, you can actually result in more value creation. And when an employer is spending less on healthcare, well, they don't have to jack up the premiums every year to their employee. They don't have to, reduce services or reduce spend. So, I mean, some employers are making copays higher, deductibles higher.
Mhm.
They're trying to figure out what to do when costs keep going up. And a lot of times they pass on those costs to their employees in one way or another, right?
Mhm.
But there's so much waste in the system. And you don't see that in Medicare as an example, because the government basically is setting a rate and it's publicly available rate schedule. So there's not this secret rate, secret charge master retail price,
This
secret
is what
spread.
it
And
is.
we have a law saying that they have to make that stuff public.
I
Wouldn't that be
know.
like the easiest thing to do?
Yes. So for
Because
the
as soon as everyone can see the prices and they go, this hospital over here is 10 grand and this one's 100, no one goes to the 100 anymore until they bring that price down.
So in the last few years, one of the few areas of bipartisan support in the United States is around price transparency. So there have been a set of laws over the last decade with increasing teeth and requirement. And today, both payers, meaning insurance companies, and hospitals have to disclose their negotiated rates across their full range of procedures. Um, And this is sometimes you call it price transparency data, or some people call it MRF data, machine readable file data. And we use that data. Now, I think the data is now available. Now, how to make it actionable is the next step, if that makes sense, because it needs to be cleaned. We have a partnership with a company called Turquoise Health, which is all about price transparency, that take this data, clean it, structure it, and give us benchmarks for each of these procedures in every zip code, in every state, in every metro, by hospital. So we know when we go to an employer to say, okay, this is what you're paying now, right, per this data. This is what we can offer it for. This is what we predict the savings would be. And by the way, your employees will get a better experience. And by the way, they go to higher quality doctors than average, so they should have better outcomes. By the way, they have a nurse throughout this process. Um, and the way we work is we have to generate savings in order to make money as a company. And so, and transparency is a really bedrock for that. And that's how the US healthcare system works in the commercial space and why there's so much opportunity to do
Hmm.
things better.
I worked in the commercial health. I work, so I've been in healthcare for 24 years. It's been almost 50-50 spent in like government programs, Medicare, Medicaid, and then the other half in commercial health plans. It is like night and day difference. Um, which is partially why I want to do this podcast because I'm like, I've literally seen the entire healthcare system like from every possible angle. And I will tell you, there's a reason I love that side of the business. I was like, I started seeing things and I'm like, I can't with this anymore. This doesn't align to my literally like morally and ethically, it does not align to my personal values. When I started seeing some of the things that were happening in that space, it just didn't sit well with me. And so I went back to the Medicaid and the Medicare side where I felt like I could deliver more value to more people. And for some of the reasons that you name here too is that, they are providing transparency. Um, but yeah, so anyway, just had to say that
And it,
because I totally get what you're saying
and it
right now.
seems like there's some really big problems that when you
Yeah.
take a minute to look at it could have some very relatively simple solutions. Like, let us see the price.
Hmm.
And I'm glad there's people working on that.
Right.
But come on, wow.
And and
Just
also
wow.
we're going global here, right? Like this is, you're looking and promoting, facilities and doctors outside of the US primarily, right? So,
Yeah, and I would say so. First off, yes, agreed. Let us see the price. And for too long, I think health plans have argued that's their proprietary data,
mhm.
even though employers are the ones footing the bill, right? But there's now law that says it's not your proprietary data health plan. You have to disclose some of this. So that's
Good.
been
Okay.
good.
So they're working on it. That's
That's
good.
We're
that's a
working on
good
it.
At
step
least they're
forward.
working on it.
Yeah, there's enough people now who see this as a problem that there's regulation for the first time in recent years to try and improve the situation. And then, yeah, and I think with our global networks, we can be transparent on what we pay, whether it's in the US or abroad. And we do something called bundled payment rates or global payment rates. So if you normally, you may not know this, but if you, let's say, had a orthopedic procedure, that ACL example you gave.
Hmm.
Well, the bill from the facility to the health plan may have like 400 lines on it, right? So you go to a mechanic and they're going to like bill you for the oil, bill you for this, bill you for this, bill you for this. It's you get an itemized receipt, if you're way you think about it, right? So the itemized receipt normally could include hundreds of lines of data from a healthcare facility. It could be for meds, band-aids, this and that, right? Um, we try and make it simple. And it's really hard to sift through that data, right? To say, what was the total price on something when each of these comes separately? And so what we do is we tell the employer and the doctor, well, we're going to just give you $1 amount to manage everything. And then we invoice the employer. It was this $1 amount. And this is what it included by and large. So I think that simplicity part of things is also really important. So it's not just the lower price, it's how you bring it together to say, here's the total cost, not a million different line items.
I remember when I was working in the value-based care space when it was kind of a new, kind of novel idea. It was about, I'm going to say back around 2010. Bundled payments was a big part of that. And that was
Yeah,
just like simplifying.
100% simplifying.
Yeah.
Yeah. And without the bundle, it's really hard to know, well, what am I truly paying,
Hmm.
right? Because it's not just there's like 400 line items from a inpatient or outpatient stay. It's just even totaling that up, getting that data from your payer, figuring out, taking out the noise data, inaccuracies. It's not easy. So it's much easier to have a conversation around value if we're just like, well, this is the total bill.
Hmm. So
And just simplify, 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 simplify.
yeah,
That's what I keep
healthcare is
hearing.
complex, right?
Yeah,
That's why we're
make it
here.
simple. And it
We're
doesn't,
trying to help.
in a lot of ways, it doesn't have to be.
Right.
Like a complicated surgery is a complicated surgery, but the billing process doesn't have to be complicated around it. We know if it's something that's done regularly, you know what it takes,
Yeah.
and people know, what it's worth. This much per hour per person for this and this and this, and like just write it out, man. And
Which
like
was kind of the impetus of like the bundle payments approach, at least I remember back in the value-based care, my value-based care days, was that there's some things that are just kind of common, right? Like certain surgeries. And so it was easier to create those kind of bundled packages. So,
100%. Yeah,
yeah.
exactly. And we do it for the common surgeries, but many of our hospital partners, even internationally, can provide a bundled payment up front, even on less common
Oh,
procedures. It's something they're very capable of doing, and it creates some certainty around costs, which you would get that up front as opposed
mhm.
to on the back end 90 days after the fact. So,
So I got to ask this question. So obviously, because we're talking about global healthcare here. Um, and I'm reading a stat that I believe I got it from your website was that 83% of the world's top hospitals are outside the US, which
yeah,
wow. I don't think a lot of people know that. I didn't know that. And I've been in this industry for a long time.
we only have a small. We're only like 1/30th of the population of the
Yeah,
world.
I think sometimes we just think that
Like,
we're the only ones that exist and matter. It's like there's
yeah,
that
like
kind of
I'm honestly surprised we have
ego.
13% of the best hospitals, or
Yeah.
17 or whatever number you just said.
So do you see, are there certain countries or cities that are especially good in gastro surgery or cardiology or, certain specialties?
yeah. I think it's more of a function of there's certain parts of the world that can provide very strong medical care more generally, right? So
Mm,
a lot of our partnerships are in Asia, for example. So Korea, Japan, India, and others, Singapore, they can have exceptionally good hospitals that are, top 250 hospitals in the world. And to give you a sense, some estimates peg it at, over 100,000 hospitals worldwide, from small to larger hospitals. So if you're in the top 250, you're doing really good. And so many of them are in Asia and in Europe. There's amazing hospitals in Latin America and Brazil, et cetera. Um, so it's not just the US, right?
mm,
And they have all the high technology. They have physicians who are exceptionally trained. They can be beautiful. They can have amazing patient experiences. And it's not in the US, right? And I agree. Sometimes we might have a more of a US centric view of it. So our mission at World Class Health is to give you the best in the US, right? So that local access, right? And again, most people are going to go local. Most people won't travel. And then for those who want to travel, get you not just, let's say, to that top 250 hospital or that top hospital in India, that top hospital in Malaysia, top hospital wherever, depending on where the patient wants to go, but within that hospital, the best physician for what they want to do, right?
mhm,
So if joint replacement, maybe the head of their joint replacement group, right? Again, who's exceptional and award winning and in a top hospital, right? And so I think there's real opportunity with us to get access to hospitals and physicians that people normally wouldn't have access to, either because it would be really hard to get onto that physician schedule or because they just wouldn't know who is the person I should see for my specific healthcare issue.
And would it typically, and do your clients, which are employers, right? You're coming in through knowing you're coming in through that channel. Do they have to have international employees, or can they just be 100% US based?
They can be 100% US based.
Okay.
And 100% of their employees could just take advantage of our US, quote unquote, our local network. Again, we have
Hmm.
thousands of doctors and facilities in the US.
Hmm.
Or it could be a company, um, a large company we're going live with on Jan 1 next year. is a large global tech company, and they have lots of employees from India in their US population. And so they can get care in the US just like anybody else, but again, are high value, high quality
Mhm.
providers. Or they could go back to India where their family's from. So you gave the example of I think going back to Berlin or to Germany for
Yeah, my
cancer.
aunt. Yeah. Hmm.
Yeah. Sometimes just thinking that same example, when someone has cancer, it could be a prolonged process. It's not like you're done in three
Right.
days, no deal. And sometimes people might be living by themselves or not have the support, and they just want to go where they have family, where they have brothers, sisters, parents, etc., because it's going to be a multi-month process, and they just want to be supported, right?
Mhm.
Rather than by themselves, right? While they're going undergoing cancer care, which can be very difficult. So we think it's different strokes for different folks, but the companies we partner with tend to value both the local network access as well as have sufficient employee numbers within their company from different parts of the world where they think they may want to access our global network.
And do you have an employee outreach sort of process for when you get a new company on? Because I know a lot of people don't even really know what their benefits include when they have workplace benefits. They don't even ask till they get sick or they get injured or something. Do you have a process in place that a company can, hey, you guys have access to this now, make sure you use it?
Yeah, so we do both, I would say, general marketing as part of, open enrollment, when the benefits year cycle kicks off. But to your point, lots of employees don't really know what their benefits are until they might need to use it, or even when they might need to use it, they don't use it because they were
Right,
unaware they
right.
have it. So we also work directly with doctors and clinicians who refer patients to our program from these companies. We also, and we've done that for many years, we also have programs in place where we can proactively identify folks who are progressing on the path to surgery using claims data, administrative claims, and other data sources, and can engage with them, not in a creepy way, but by just letting them know, hey, you have access to this benefit. So let's say whether it's a mailer or an email, and then it's voluntary, they can choose to engage with it or not. And so for us, to your point, engagement is always one of the most important things that we can think about because you can have the best product in the world, but if people don't know about it, they're not going to use it. So we think
Yeah.
about reactive as well as proactive ways to engage.
Cool. Good.
And it just popped in my head too as I was thinking about how, let's just say hypothetical situation, right? Like I work for an employer, world-class health is one of my benefits, and I decide I would like to have I'll say bariatric surgery, done in, I don't know, India. Um, but all I have is a passport. Um, you've got recovery time. There's usually like a tourist visa, there's certain types of time frames that are assigned to. How does that work for somebody that's going to use that who's going out of country, might have time limitations? Like, do you ever run into that? Do you ever see those kinds of scenarios that they need a long time of recovery that might go past like a standard? I know, is it like 14 days? I'm not even sure.
Yeah, I mean, it's a great question. So first off, I would say we help people get passports. We've gotten
Hmm.
thousands of
Oh,
passports for people over the years.
okay.
And that's really interesting because people sometimes are traveling, even though they haven't had a passport, so they've never left the country.
Mhm.
So we get passports, and then to your point, we get medical visas. And in all cases, it would be
Medical visa.
someone out,
That's
yeah. So it's
okay.
usually a medical visa versus a tourist visa. Now, look, the law is different for each country that we may
Mhm.
work with. Like, there's not one standard approach, but um, we follow whatever is the standard process. And in most cases, like if there's a medical visa, it's usually 60 days. So
Oh,
people
okay.
traveled home well before that.
Mhm.
Some of our hospitals even have, because they're such high tier hospitals, they actually have the ability to extend visas within the hospital if that was ever needed without
Mm.
going, to a embassy or, any of those sorts of things. And so it's actually quite easy to do that. And we do all the navigation, the letters from the doctor, et cetera. And depending on the country, we can usually get the visa taken care of within less than a week.
Wow.
Oh,
Even help with the travel. That's pretty cool.
Yeah.
ooh,
It's like
unexpected bennies.
I could use a
we can
passport.
do the travel, we can do the airfare, the visa, the hotel,
Oh,
airport.
wow. All that too.
Yeah, and in some countries, because the cost of care, it's exceptional quality, but because it's just less expensive than the US,
Hmm.
you can actually invest more in the patient. So in one of the countries we do, let's say for orthopedic surgery, we literally have nursing and physical therapy come in daily to the hotel room after the person's been discharged from the hospital so they can recover as quickly as possible before they go home, let's say 8 days after surgery or discharge. So you actually can do more in many of these settings, and that would be prohibitively expensive in the US to do all this stuff. So it can be a much better experience, and people actually can be more recovered sooner, if that makes sense, so that they're
Hmm.
able to go back to work with higher
Yeah.
functions.
It's
Therefore, improving outcomes and
it's like
lowering costs.
it's like a healthcare vacation. It almost feels like it turns it into an adventure in a way that could put a really positive, more healing aspect to it, honestly. Like I'm
Mhm.
going to go to this place and get better. Like
Mhm.
that's the specific reason you're going. And you are leaving home, but if you have that support structure where every day these people are coming in to help you with your process and help you with your recovery, like wow, that almost yeah, that almost feels like better than being at home.
Mhm.
I mean, for some people, like, if you're have a procedure and it's one of those same day discharges or next day discharges, you're home, you're back in your life and
Yeah.
dealing, whether it's childcare or cooking or this, right? I think when you're abroad, you can recover, right, without some of those same distractions. We also fund a companion to travel with the patient,
Oh,
because we don't want them to be lonely and things like that. And we are looking for someone who can help the patient in their recovery. So that's also a key part of our model, because we just think it's good for outcome. So it is, to your point,
Hmm.
it's actually a differentiated experience. It's not just
yeah.
lower cost of care and higher quality. It's actually a different, and for some people, a better type of experience than they would have gotten back at home.
Yeah, that really brought it home for me right there.
Yeah.
With like the real scope of that. That's really cool.
So, as I'm thinking about this, so world-class health shows up, you've got cost transparency, you're basically institutes of excellence in terms of clinical care. I mean, this sounds like ideal state, right? If as world-class health grows, do you like how do you see your company, the way you're doing things in a really smart, the way that people really want? How do you see that kind of shaping the rest of healthcare? For
Yeah.
like, are people going to catch on and be like,
If the whole price
thanks?
thing, if everyone has to show you their price on everything, that's a huge shift in its
Right.
own right
Like,
there.
how do you see yourselves influencing all the other parts of, and you obviously have a Medicare background too, so I can see having
Yeah.
having some, your hands into that. So,
Yeah. I mean, there's so much to talk about here. So I would say, first
yeah.
off, in the near term, we've started with planned elective surgeries. We're next year expanding into cancer, into infusions, to radiology, and other things that are important as part of healthcare,
Hmm.
patient healthcare experience, and they represent about 50% of the total cost of care, right? So it's a pretty big surface area in terms of where we're leading into. The second is, to your point, there's going to be a focus on transparency across all of it, right?
Hmm.
Transparency into basically benchmark rates, transparency into what we're spending, and the savings that are generated as a result. And then with all of this, not only are we picking what we think are the best doctors, whether it's going to be for cancer care, whether it's for a gallbladder removal, whatever, we are collecting a standardized data set across the globe, which we believe in the next 5 or 10 years will be the largest global comparative effectiveness data set on doctor quality. So just like you can go on Amazon and look up the rating, or Airbnb or Verbo or this or that, how many stars did that property get, and what were the what did they have to say about it, the people who stayed there. We're going to be collecting, and we are, a longitudinal clinical data set. So not only if it is covered through business, but what if there's a point in time where people just want to pay for it out of their own pocket, right? So
Hmm.
they like, so what, coming back to dentistry and things like that, where we started, which is, for any number of reasons, someone may want to just purchase healthcare on their own, or some health plans now are just saying, I'm just going to give you $5,000, go use it the way you want, or $10,000, just use it the way you want. We're not going to cover things. So then people are just going to be incented to say, like, how can I get the most value for that $5,000 or that $10,000 that I have insurance for? And we think they're going to want to shop on potentially an individual market like this, but where they have more confidence in quality, they have more sense of price. And we'll have to figure out the model at that point, but our team can still do the navigation and sort of connect the dots for them.
Hmm.
So it's a differentiated experience. So I think over time, I'm imagining greater surface area, really pushing on transparency, leveling up the quality data set with standardized quality reporting wherever we are, and then potentially having a B2C model.
Hmm.
Um, because look, I think we're going to moderate trends and costs, but it's still expensive. And sometimes
Hmm.
people are just, they don't have insurance or they're forced to buy things on their own. It's the same challenge. How do they get good quality, good value, good experience when they don't even have insurance? So I think
Yeah.
there's lots of ways this can go, but I think all of the ways we're envisioning, we think consumers can benefit, employers can benefit from these changes.
Yeah, I love it. I like to see where healthcare is trending um, in a different direction, I think. And so, yeah, I think over the next 5 to 10 years, we're going to see a lot of change in this space. So, and sounds like you're kind of setting yourself up to be a part of that change. So,
Yeah, forerunner in that.
yeah, it's I'm here for it. I think I say that at every episode. I am here for it.
Yeah.
Bring us all the change. That's what we're here to talk about on the uprising is the innovation, the good change that's happening. The really kind of different stuff that folks like you are doing.
It's not just the price, it's the whole process of the
Hmm.
thing that can be so much improved with this that, yeah, it's definitely encouraging.
Yeah, it is. It is. Well, with that, as we kind of wrap up our conversation here, how would somebody find you online? How would they get started? Where can we send our listeners to find world class health?
Yeah, so if you just search for World Class Health or www.worldclasshealth, one word.com, that'll take you to our website. And you can learn more about us. There are links on there if you have questions. If you think if you're receiving insurance through your employer and you think you would benefit from this global benefit offering, I think the most powerful thing you could do right now is talk to your employer and put them in touch with us. I think it's very powerful when people hear from their own sort of constituents, so to speak, saying, "Hey, here's something I heard about. Why can't we do this?" Right? Because it's going to save money, it's going to be a better experience. That's the most powerful thing we can do. And the thing I may want to end on is we're talking about regulation that was improving transparency. There's now regulation that says it's called the Consolidated Appropriations Act, CAA of 2021. Employers now have a fiduciary duty to review their healthcare spend because ultimately it's coming from their employees, right? One way or
Hmm.
the to ensure they have the right prices, the right network. And so there's more pressure on employers than there's ever been to not just rely on what the insurance company is telling you that they're doing, but to really look deeper to say, hey, are there opportunities for better quality? Hey, are there opportunities to save money? Hey, is there opportunity for a better experience? And so in this world of the CAA and employees going to their HR leaders, their finance leaders to say, hey, why don't you diligence this option? I think we're getting to a place where, more and more people are going to implement us or similar strategies because there's now legal risk to not doing so. It's not just the right thing to save money and to help your employees, but for the first time, there's legal risk.
Yeah,
Nice. I like that they're starting to push those buttons.
yeah,
Yeah.
yeah. And
Yeah.
but the power of the people, that is the best thing. Having worked with with benefits consultants and actual employers on their benefits, like coming straight from their people, especially really big companies that have a very diverse group of people, whether they're international or just in multiple states, things of that nature. Tell them what you want because they may not know, right? Like they're overworked. They're just as overworked as everybody else. So
Yeah.
we're all trying to, keep our head above water. So I think that's a really good message to end on too, is that always be an advocate, right? For the things that you want, that you think will benefit for you and your health. Whether it be from a benefit through a company like yours or your own personal health journey, right? So
100%. Be an advocate.
awesome. Dr. Kumar, thank you so much for coming on the show. This has been a really different conversation, I think, and a needed one around cost transparency and access that it's going to become a bigger and bigger thing, I think, in the forefront of many conversations. So, very, very good to talk with you about it. So thanks for coming on.
Yeah, much
Yeah,
appreciated.
thanks for the time. I enjoyed it.
Awesome.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at the Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.